Hi, welcome back. I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, I hope that you got some sleep in your 2 weeks off, actually 1 week off.
1 week. I did. It was quite lovely.
Well, since you left, we've had a Labor Day holiday, which we will get to in a second. And the Chancellor of the University of Illinois, Robert Jones, sent out a letter, an email to everyone saying, stay in your dorm, stay in your office, go to class, get food, get essentials, and then get back in your room. Has that worked?
Well, it actually has. It has actually been very helpful. It's a combination of things. So it's a combination of that letter reminding them that they need to stay in there, especially if they're in isolation or quarantine. They are not to be leaving. And then just to remind everyone else that, there's a lot of it. There was a lot of it going around. But those initial massive cases, a lot of that had to do with kids moving in. We found out, a lot of them had parties and things before they left. They moved down here. They were infected, but they were caught early, put in isolation and quarantine. So the idea, of course, was not to have a bunch of outbreaks, but then some kids ended up going to parties and then having parties, and that caused a problem. But things are looking much better right now.
Speaking of the U of I, the saliva-based testing has gotten a lot of national coverage. Is that as effective, equally effective, or less effective than the not all the way to the brain, but the nostril testing that's happening out at the mall?
Yes, it is a little bit more effective than that. Has a few less false negatives. So it is a little bit better test. But what makes that test so amazing is that it skips the entire, one entire process, which is going to allow it to be used all over the country. And it's very quick. So between the mall, don't wait for the saliva testing because of you think the mall testing is not quite as great. It is. We're super lucky in this community. We have a lot of access to testing. Today, what are we up to? Over 380 some thousand tests done in just this county. So, go ahead and get it at the mall. If you're on campus, get it on campus. And, we'll get the results quickly, and then that allows us to do our public health work behind the scenes that helps to shut down outbreaks.
So the university has been testing everyone, faculty and students, twice a week. And then if there are positive cases, have they done a good job of quarantining them and putting them in dorms and sending them home?
They've done a very good job. We knew they would because we've worked with them forever. They've never had that many kids to isolate or quarantine. Of course, neither have we here at Public Health, but they are doing, a good job. What happened with some of them is that they got out of isolation and quarantine and went and did things they weren't supposed to. We don't have people watching them, 24 hours a day, anyone in isolation or quarantine. We rely on them to do what is needed to be done to prevent the spread. So, the U of I is doing a really good job with this. They have the app. They have, a lot of community support, and so far it's looking pretty good.
So let's say that the students have now dropped the curve here and we're okay and we can stay here until the Thanksgiving break as previously planned. Is there a scenario where they can't come back after winter break due to another wave of COVID or influenza A?
Anything is possible. So I can see, I don't think it's likely, but I could see a scenario because, again, our community is doing a really good job in general of everything that we need to do to keep this virus down. But if we were to, they were getting ready to come back and our hospital systems, for example, were starting to get overwhelmed, I can see that would be a huge red flag where we would recommend them not coming back. So again, we still have to protect the hospital system. The kids seem to have gotten it, had mild cases, and as long as they stayed, where they needed to stay, we weren't seeing community spread from that. So that's a good thing. And the people in our community, especially those who are at risk, seem to be doing a really good job of everything that they need to do. Social distancing, mask wearing, staying out of places where if they don't need to be in there, for example, and they're doing a good job. So unless our hospital system were to become overwhelmed, I can't think of another reason why they couldn't come back. But then again, who knows? So I'll just leave that open. I'm not sure. I do expect them to come back, however, but
Far be it from me to ever question the great Julie Pryde, but you say the kids did a great job staying socially distant, and they did.
no, the community did a great job.
Okay,
I
the
did not say the
community-
students.
That's where I was going with this, is that I got included in 3 different barbecue / parties out here in Champaign over the Labor Day weekend.
Oh,
So
that's, well,
are people still congregating? Are we going to see an uptick in numbers, or have we already passed that point where we might see a Labor Day uptick?
we're already starting to see some spread from Labor Day activities. But again, you know, if the events are outside and socially distanced, you know, you can do things, and masks are worn, things like that. But again, if these parties end up being just a bunch of people hanging out together, like things are back to normal, then if there was a case there, we will see spread. And so far we're like, what, 5 days in or so, 6 days in, something like that. We are starting to see some of the cases from that.
Dr. Anthony Fauci says it could be until mid to late 2021 until we are, quote, back to normal. So the vaccine comes out. Let's just say it came out in March. We still have to mass inject everyone. I mean, and then we need the herd immunity. It takes a few weeks. We don't know when normal is, do we?
We don't. We know what situations will get us to that, but we don't know yet. So we do know that it is not going to be this fall or this spring or this winter. So we need to just, you know, try to maintain what we're doing and get your flu shots, and then try to move through the winter. Winter makes everyone a little nervous because of we already have hospitals filling up with preventable flu and other respiratory viruses. So, you know, anytime you have people indoors congregating, which obviously is done more in winter, it's concerning. So people are just going to have to maintain what they did last spring and what we've been doing since then until we get out of this pandemic. But it will end. It will end.
Are there any confirmed cases of flu yet, or is it too early in the season?
We have not heard of any right now. It's not a reportable disease, but we usually see that. If people are interested in keeping track of how the flu numbers are going, Illinois Department of Public Health has a really good website that allows you to see community level spread in various places. We will be probably linking to that in our social media as well, because it is, you know, we let the community know, obviously, when flu gets here, but we want people to get vaccinated before it gets here.
Is the flu vaccination available yet, to your knowledge?
It is. It is. It's been shipped to a lot of places. Pharmacies have it. Where some of the Carl and Christy have scheduled their clinics already. We have flu available for some of our high-risk clients. Let me see what we have here. I'm trying to look at my little list because Carl's, if you look on Carl's website, you can see their drive-through flu clinic, and the same thing with Christie Clinic. And then you can also call, you know, if you use Francis Nelson or if you use a pharmacy, you can just call ahead and make sure that they have it and get any questions you have answered before that. But if you're 6 months of age or older, everyone really needs to take a flu shot this year if you can.
Who should get the pneumonia shot?
Pneumonia shot, that will be evaluated by by your healthcare provider. But in general, it's people who have any type of illness that could make them more at risk for developing pneumonia or having a negative outcome from pneumonia. So older people over 65, people who are smokers, people who have asthma or chronic obstructive pulmonary disease, things like that. People who are on various, drugs to suppress immunity. So but just check with your healthcare provider. And if you don't have a healthcare provider, you can call into CUPHD and we'll get that information for you. It's also online. I mean, you can Google that at the CDC. Who needs a pneumonia vaccine?
Okay. A question that I'm asked a lot and that I don't really know the answer to is that someone who eats in a restaurant is twice as likely to develop COVID-19 as people who haven't eaten in a restaurant. Tonight is Takeout Tuesday in our house. We still have not been comfortable eating in a restaurant. As the months get colder, do you recommend, how do you recommend we navigate eating out?
Well, so the guidelines are out. It's going to always be safer outside. Once you're inside, the masks are going to be off, and it's just going to be, there will be an increased risk. If you just are staying with your cohort at your table, that's obviously going to be safer than if you get 9 other friends and you go out and you all sit together and eat. So it's who you're exposed to. How is the restaurant doing on its infection control? And ours are really doing a good job in this county as far as keeping the seats far enough apart and things like that. But in that study that where they talked about that, where people were more likely to, where they were more likely to have eaten in a restaurant, they also were more likely to have gone to other things like coffee shops and bars. Bars are going to always be a problem. They just are for a variety of reasons. But, so probably a lot of the people that had it, that were in the bars, were in the restaurants, are probably people that just go out and about more often in general. I don't think there's anything specific to that restaurant, to a restaurant that makes it any more, unsafe than being in anywhere with unmasked people in a building.
And it is safer to, let's say we wanted to go to a rally outside with masks than it would be inside without masks at a rally, correct?
Oh, there should be nothing being done inside, not socially distanced, without masks, period. And that's going to have to remain that way until this pandemic ends, because a rally or something, for example, you would be shouting or talking loud, yelling over noise, things like that. It's very dangerous.
And last but not least, get your flu shot. What other pearls of wisdom would you like to leave us with today?
Well, I don't know if I have any pearls of wisdom, but definitely the flu shots are very serious this year, more than, I've been saying this for how long, 25 years. Every fall I say, get your flu shot, get your flu shot. But this year it really is important to help protect our healthcare system, as well as no one wants to get flu. I don't know why people keep telling me this thing that I find so bizarre, but they'll say, well, I've never had the flu, so I'm not getting flu shot. Well, right, but that there's no correlation there. So it's like I tell people I have never flown through the windshield of a car, but I still wear my seatbelt because I don't want to fly through the windshield of the car, right? Flu is the same way. If you haven't had the flu ever in your life, you're very lucky. But that's all it is. It's very lucky. Everyone is susceptible to it, and it is miserable. I can tell you from experience, it is miserable. And it can be deadly.
Agreed.
And this year, when we have COVID going around and all the other, all the other respiratory viruses and things that go around, we do not want to see the healthcare system become overwhelmed. And it could happen really quickly when you have both going around at the same time. So going into winter is, it will be the time in this pandemic where we really have to do everything we can to protect our healthcare system, because it could be a really rough winter. Again, I look at our community to be doing better than most communities and most states. Illinois is doing a better job than a lot of states. But that all has to do with just the vigilance of the people doing it. So we have to maintain that if we're going to get through this winter in the best possible way.
Well, we listen to science and we listen to you. We also listen to Urbana Mayor Diane Marlin. She knows what she's talking about. She's keeping her community safe.
Mhm.
You and I listen to our producer, Jason Liggett, because UPTV exists because of his hard work. But this community continues to do better than the rest of the state and even the rest of the country for sure because of the leadership of Julie Pryde, Administrator of the Champaign-Urbana Public Health District. Thank you so much, Julie.
Oh, well, that was a bit dramatic and not necessarily true, but I appreciate it. But we had just have a community that's worked together for years and years, and that cannot be taken lightly because we see the other places where it's not happening, and it's sad. We also have a lot of science believing people in this community, and way more than I realized. But I didn't even know that that was going to be a problem in other parts of the country, but clearly it is. So
Well, who knew?
always, like I said before, always get your information from trusted sources. The CDC is still trusted sources, even though there's some game playing going on. Apparently, we just found out this weekend about that. But the people doing the science at the CDC will not be compromised. They will get their information out.
Well, we trust you and we trust your organization. So thank you, Julie Pryde, and we'll see you again for next week's update, okay?
All right. Thank you so much.